Alright, so I'm going to demonstrate the shoulder test for the shoulder lab. The first one we'll start with is the piano key test. This is very, very simple test. If you suspect that you have an AC ligament sprain, whether it involves just the AC ligament or the AC and the CC ligament, all you would do is simply, you would see the clavicle actually raised, displaced superiorly, and you would just take your two fingers and you essentially push on it, and it would be almost like pushing on a piano key. It should go up or it should go down and then come back up when you release the pressure. And that is all there is to the piano key test. And that's just showing that there's obviously some laxity, that there's a compromise in the ligaments themselves, and the person might even report pain when you do that test. The next one is for glenohumeral joint instability, and that's a sulcus sign. This one would be just simply grasping the humerus itself. You can actually stabilize up here at the acromion, and then you're just going to simply pull down, and you're going to look for a sulcus to appear. So basically a dip here at the shoulder joint. And this is going to show glenohumeral instability, especially in the inferior direction. The next one is a Hawkins-Kennedy test. This is a shoulder impingement test. And so with this one, what you're going to want to do is you basically flex the shoulder out to 90 degrees. You're going to also flex the elbow here. And then you're going to grasp here at the wrist, and then you're going to internally rotate the shoulder. And while you're doing that, if the patient describes pain or is resistant to doing this, has a grimace on their face, this is really painful for them, then we can assume that they have some sort of impingement issue. Now what that impingement is, we probably have to do a little bit more investigating. It could be in numerous things. It could be a subacromial bursitis. We could have a problem with the subscap. We could have issues with the labrum, etc., as we discussed in class. Another one that we can do to actually test supraspinatus weakness, if we suspect that there's potentially a rotator cuff tear or some sort of impingement issues, we can do what's called an empty can test. And so with the empty can test, the patient's going to bring their arm up to 90 degrees flexion. We're also going to abduct it about 30 degrees. And then we're going to internally rotate the thumb so that it's pointing downwards. So basically you're emptying a can out onto the ground. That's why it's called the empty can test. And then you're going to want to stabilize here at the shoulder and then push down. And you want to stabilize at the shoulder because you want to make sure that their traps aren't compensating. So you're trying to get them to essentially resist you pushing them down. And you really don't have to apply a lot of pressure even for really strong individuals. But if you can feel that their traps and their levators are being activated, that's them compensating for the lack of subscap strength. Supraspinatus strength, So you want to make sure to stabilize there so that they don't cheat and then push down. If they have an incredible amount of weakness, compare them to the opposite side. So if their arm just really quickly drops, they have hardly any ability to resist you. They definitely have some supraspinatus issues, or if they report a lot of pain and discomfort with that, as well as weakness. Next one you want to do is a crank test. This is also for glenohumeral instability. This is when you suspect that someone is a chronic subluxer or dislocator, that they have a lot of that anterior instability. So with this test, you're going to essentially take them into the position that they would go into if they were going to dislocate their shoulder. And the most common position for dislocation is this position here. When they're flexed, they're abducted, and they're externally rotated. So you would just slowly take this person into this particular position. You can also do this while they're lying on their back. And if they report pain or they actually express to you that it feels like their shoulder is going to pop out of place, then definitely do not push this any further, because you actually can dislocate their shoulder, especially if it's someone that has a lot of anterior laxity. So the crank test is simply testing anterior instability. The lift-off test. So this one is the last one here in our lab. This is looking at a lesion or weakness of the subscap. So the subscap is the muscle that's going to be on the inside of the scapula itself, so it's on the anterior side. In order to test that, you're going to ask your patient to stand up, their back turned to you, and you're simply going to ask them to put their arm behind their back like this. You're going to apply some resistance to their hand, and you're going to ask them to lift their hand off their back against the resistance of your hand. An inability to be able to do this would indicate that they have weakness or some sort of a subscap, tear potentially, and pain, of course. It could also mean that they have some tendinopathy issues, so not necessarily a tear per se, but maybe some really bad inflammation or tendinosis that's developed over time. And those are the tests for this lab.